Hello everyone, my name is Prabhath and I'm a PhD candidate in Human Development and Family Science at the University of Missouri, USA. Today I'm pleased to present my proposal titled Assessing Developmental Trends in Selected Early Childhood Mental and Behavioral Health Issues in the USA, the role of social determinants in early childhood. This study explores how children's mental and behavioral health outcomes have changed over time in the United States and how social determinants of health, such as family environment, socioeconomic status, and community factors, shape these developmental differences. Moving to the introduction, social determinants of health are the non-medical factors that influence health outcomes. In the United States, health and healthcare inequalities affecting racial, ethnic, and socioeconomic groups remain a major public health concern. The Healthy People 2030 initiative highlights the importance of addressing social determinants of health with objectives focused on five key domains, including economic stability, education, healthcare, neighborhood environment, and social context to help reduce health disparities across the population. The Canadian Council on Social Determinants of Health identified 36 different frameworks used around the world to understand and address social determinants of health. Similarly, the National Academies of Sciences, Engineering, and Medicine reviewed and categorized 10 major social determinants of health frameworks within the United States. The World Health Organization's conceptual framework is one of the most advanced models for understanding how social and economic factors influence health. In the United States, the National Center for Chronic Disease Prevention and Health Promotion developed a framework based on six key pillars, combining the Healthy People 2030 guidelines, the WHO frameworks, and the 10 essential public health services to guide efforts in reducing health disparities. A main critique of current social determinants of health frameworks is their reliance on generalized solutions, which often fail to reflect the diverse social and cultural context influencing childhood development. Most studies also lack child-focused, longitudinal, or nationally representative data, limiting our ability to create targeted, evidence-based intervention for children's health. To address this gap, this study draws on the WHO Social Determinants of Health framework and five key social determinants of health domains in the Healthy People 2030 using national data from the United States. And this study focuses on childhood anxiety, depression, and behavioral conduct problems, examining how these outcomes vary across major health policy changes, including the Affordable Care Act and COVID-19 related policies. In the United States, the most common childhood mental health conditions are anxiety, depression, and behavioral disorders. Anxiety rose to 11.6% in 2012. It's a 20% increases in 2007, and COVID-19 further worsened this. Depression affected 4% of children with higher rates in girls, and about 7% of children have behavioral disorders, more common in boys. Based on this background, the study consisted of four objectives. The first three objectives examines how structural and intermediary social determinants associated with early, middle, and late childhood anxiety, depression, and behavioral problem, and evaluate trends over historical time. The fourth one, it also seeks to compare these association across developmental stages, including early childhood, middle childhood, and late childhood, and to evaluate how these patterns have changed over historical time using national data sets. Here you can see the conceptual framework used in this study. It integrates the CDC's five social determinants of health domains and the WHO conceptual framework and data from the National Service of Children's Health. The socio-economic and political context associated with early, middle, and late childhood will not be included in this analysis. These are the variables which considered in this analysis. Some variables will be excluded when it does not include in the relevant data years, since the national data does not capture it. For this analysis, the variables are organized into structural determinants and intermediary determinants, reflect the key domains of WHO and CDC frameworks. According to the literature, much of the existing research has focused on a limited set of determinants such as socioeconomic context, housing instability, and adverse childhood experiences. So it is important to move beyond isolated risk factors and examine their combined and cumulative effects. Now, I will discuss about the method of this study. This study uses data from the National Survey of Children's Health combining four data sets, 2011, 2012, then 2017 and 2018, then 2020 and 2021, then 22 and 23. These datasets allows us to examine trends in childhood mental and behavioral health across different historical periods and policies, including around the time of the Affordable Care Act, then pre-COVID, during COVID, and post-COVID. This is a secondary analysis used in a non-experimental cross-sectional research design. The study population includes children aged 3 to 10 years residing in the United States. The study follows a comprehensive data analysis process. The dependent variables are the social determinants of health, and the dependent variables are anxiety, depression, and behavioral or conduct problems. As mentioned earlier, the study includes 4 time points: the Affordable Care Act period, pre-COVID period, during COVID, and post-COVID periods. For the first 3 objectives, the analysis will include descriptive statistics, correlations, structural equation modeling, multiple group structural equation modeling, and pseudo latent growth curve modeling. Each analysis will be conducted separately for each age group. Pseudo latent growth curve model is used because the data are cross-sectional and do not track the same subjects over time, allowing us to examine trends across time periods. For the fourth objective, multiple group structural equation modeling and pseudo latent growth curve modeling will be used. In this case, childhood age group will serve as the grouping variable to compare association across developmental stages. Data analysis will be done through our software. Here, I have provided an example of the analysis for further clarification. Start with descriptive statistics followed by correlations. Then you can see the structural equation modeling analysis for the 3 to 5 age group using the P4 data set, which is 2022 and 2023. This shows the multiple group SCM, multiple group structural equation modeling analysis results for the 3 to 5 age group across the all 4 time periods. The results indicate that the data and model are suitable for the pseudo latent growth curve model analysis. This slide provides an example for the pseudo latent growth curve model that I will be using, and the figures for other analysis will be similar to this. Specifically, this figure shows the actual analysis for the 3 to 5 age group examining the relationship between safe neighborhood and early childhood anxiety. This is an example for multi-group structural equation modeling in the fourth objective, and pseudo latent growth curve models will be done for each significant variable across age groups. The expected findings includes a significant association between social determinants and childhood anxiety, depression, and behavioral problems. These associations are likely stronger during COVID due to increased uncertainty and disruptions, and they may vary across developmental stages, with the stronger effects in the late childhood compared to early childhood age. These are the probable limitations of this study. Actually, this study has several limitations. The causal inferences cannot be made, and self-reported data may introduce social disability and record biases. Using ordinal measures for key constructs may reduce precision and limit detection of subtle variations in child behavior and caregiver characteristics. Additionally, residual confounding is possible. The implication of this study are threefold: theoretical and research, policy and programming. It can advance understanding of how social determinants shape childhood, internalizing and externalizing health and behavioral issues, inform evidence-based policies, and guide the design of programs and interventions to better support children across developmental stages. These are my references, and thank you very much. I would like to sincerely thank the Global Psychological Science Summit committees for giving me the opportunity to present this proposal. I look forward to any questions or feedback you may have. Thank you very much.